Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today in the playlist of oral and maxillofacial surgery we will be discussing the most frequently asked topic and the most frequently encountered case scenarios in your practice, and that is the impaction. So what is basically an impacted tooth? An impacted tooth, it is one that failed to erupt into its normal functional position in a dental arch within its expected time due to some physical obstruction that is present out there. So we need to remember three key points. First of all, it failed to erupt into its normal functional position. Secondly, it fails to erupt in the normal expected time of eruption. And thirdly, it usually occurs due to some physical obstruction. So now we will be discussing some commonly tooth that remain impacted. In that, the first common tooth is the maxillary and mandibular third molars, followed by the maxillary canines, and then followed by the mandibular premolar, usually the second premolar. So now we will be discussing the timing of eruption for the molars. First of all, the tooth germ, it is visible on the radiograph at 9 years. Then the cusp mineralization, it is completed approximately 2 years later. Crown formation, it is completed at 14 years, and root approximately it reaches 50% of its size at the 16 years. Root completion occur at 18 years but with the open apices. By the age 24, the 95% of complete eruption it occurs. So usually the eruption of time for the third molars is around 20 to 25 years. But at 11 years, the impacted tooth, it lies at the anterior border of the ramus with its occlusal surface that is facing anteriorly. Now during the root formation, the tooth, it changes its orientation from that horizontal position, then it goes a bit mesioangular, and then it reaches the vertical orientation. So average age for the completion of eruption of third molar that we have discussed earlier, it is usually the 20 years, but it may continue on to the 25 years. So this was briefly an explanation about the timing of eruption of the molars and also about their change of orientation that occur. Now any abnormalities that will occur during its change of orientation will lead to its different impaction at different angulation. So we will be first discussing the causes for the impaction of these teeth. In the causes, we have the local categories and the systemic causes as well. So first of all, the local causes, it involves if there is an inadequate arch length, that is the space available, it is less than the space required. So it will definitely lead to the impaction of the tooth. Then dense overlying bone that remain a physical barrier for its eruption. Obstruction by any other tooth, that may be a retained deciduous tooth, it may be the retained deciduous roots, or it may be a supplementary tooth that can result in the impaction of a tooth. Any excessive soft tissue that is present, again it will present a physical obstruction or barrier. Secondly, any kind of cyst, tumors, developmental or genetic abnormalities, or abnormal path of eruption. So these were some most important local causes for the impaction. Now we will be discussing the systemic causes. It usually includes the rickets, anemia, congenital syphilis, tuberculosis, the endocrine dysfunction, malnutrition, cleidocranial dystosis, achondroplasia, and cleft palate. So these were some important systemic causes. Now we will be discussing the etiology of impaction, that what is the main etiology. First of all, failure of rotation from the horizontal to the mesioangular to the vertical, that was the normal change of orientation. It is most common to occur and it is the most common cause of impaction. So we need to understand that normal orientation changes in order to get an idea about the impaction. Secondly, any differential growth between the mesial and the distal roots, they can cause the tooth either remain mesially inclined or rotated to a vertical position. For example, the underdevelopment of the mesial root, it can lead to the mesioangular impaction. Secondly, the overdevelopment of the mesial root can lead to the distoangular angulation. the overdevelopment of the distal root, it could result in the mesioangular or horizontal angulation of the impaction. Another important etiological factor is the inadequate bony length. Bony length, it is inadequate, that can definitely lead to the impaction. And retarded maturation of the third molar, that is the dental development, it lags behind the skeletal development. It is also most common and important etiological factor for the impaction. Now we will be studying some eruption potentials, and for that we need to study that space available and angulation, they are the two most important factors that will determine the eruption potential of a tooth. So first of all, if there is the required amount of space available, it is enough for the eruption to occur, the tooth will definitely erupt into its desired space available. But if the space available, it is less than the space required, it will lead to the impaction of that tooth. It will usually not erupt due to the lack of space available. Second important factor that will determine the eruption potential is the angulation. So by 18 to 20 years, the third molar that are usually horizontal or mesioangular, there are decreased chances that these teeth will erupt into a normal position. The one that are vertical and there is the required amount of space available, there are increased chances that that tooth will erupt. Now if the crown to the space ratio, it is greater than 1 and the tooth orientation, it diverges substantially from vertical, the tooth is unlikely to erupt. So by judging these two factors, that is the space available and angulation, we can make the early decision of either extraction of the tooth or either the tooth will be able to erupt it into its normal functional position. So now we will be discussing the best time for the tooth removal. For example, we have taken radiographs at the 18 years or prior, and we have come to know that space available and angulation, they were not favorable and the tooth, it is unlikely to erupt. So what is the best time for its removal? Here we need to remember one point, that early removal, it will reduces the post-operative morbidity and also the rapid healing will occur in that case. So usually in the younger ages of the range from 17 to 20 years, the root that is formed 1/3 and before they are 2/3 formed, that is the best time for the tooth removal. Again, in the younger ages from the 17 to 20 years and when the root is formed 1/3 and before it get formed 2/3. So that was the best time for its removal. So this is the best time for removal due to the following factors, because in the younger patient, they are better able to tolerate the procedure. Secondly, the rapid healing can occur. Thirdly, the bone, it is less dense. As the person it ages, the bone become dense and it also become less elastic. More complete regeneration of the perial tissues can also occur in that age range. Recovery quickly with less interference to life is also another important factor regarding the timing. And again, the root formation, it is incomplete, so we can easily extract out that tooth. So due to these reasons, it was better to remove that tooth in that age range, that was 17 to 20 years. So this was about a brief intro of the impaction. In the next video, we will be discussing the indications, contraindication and classification for the impaction. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.